morning and welcome to Arkansas Surgical Hospital. We are here with Dr. Sam Moore. Thanks for being with us today.
Thanks for having me.
Yes, and we're talking all about arthritis and really how to have fulfilling lives even though you have this thing called arthritis. So let's start from the beginning. What is arthritis?
Yeah, it's a good question. The arthritis is something that affects a lot of people, mostly adults. This is something that gradually happens over time, most of the time, where the cartilage, for lack of a better word, it just gets thinner. And sometimes it starts to flake off or get to where there's too much friction at that joint surface. And that creates pain, it creates disability and stiffness.
Oh, and I gotta wonder, is there anything we can do preventatively, or is it one of these things that you're gonna get if you're gonna get it?
So we aren't certain who's gonna get it. It's not like a gene you inherit, but it is something that typically follows the path of inflammation. If somebody has a lot of inflammation for various reasons, or if they've had some sort of injury, a fracture or a sports injury as a child, that can lead to arthritis at a younger age, and it can be debilitating for a lot of folks.
It can be debilitating and very painful, but we want to let you know it's not a death sentence. So you don't have to sit still, become sedentary, that there are still things you can do and should do. So what kind of advice can you give those out there that are really in pain or suffering from arthritis?
Yeah, so most of what we're trying to do is keep people moving.
Okay.
The arthritic joint hurts, and that pain is your body's response to an injury, or the friction inside there where that joint has thin cartilage creates a little friction and a little inflammation, and that can lead to swelling and pain. And so what we want to do is try to manage that pain. Sometimes that's done with medicine, sometimes it's injections and that, but most of what we're going to do and recommend patients do is keep moving and keep their strength. Those two things are what typically limits people's function, is stiffness and weakness, and sometimes that can even lead to falls. And
so how do you respond to them when they say, well, I'm not going to move because it hurts when I move?
Right.
How do you help them out?
Right, that's a good question, yeah. It's a very tough problem because it hurts, and we have pain, and when we have pain, we tend to sit more. And then when we sit more, we tend to get weaker and stiffer, and this creates more problems. So a lot of what we're doing in the office and in any procedures we do is trying to decrease that pain so that they can tolerate the real treatment, which is keeping the therapy starting, keeping them on some home stretches. And I really want people to engage in a routine. It doesn't have to be any kind of intense, bodybuilding routine, but you need to keep your muscle tone, and that can be something as simple as a little spin bike or a little walking path around the house. These are just ways to keep the muscle tone.
So really that low intensity, we're not asking you to go run a marathon, but walking, those cycles that you say that take off the pressure maybe of those joints, that kind of thing.
That's exactly right. If we're wanting to keep you going, we're really going to have to just start somewhere. And that can start, a lot of these machines we see at the gyms will help, cycling and rowing and ellipticals. Those are going to be less impact on the joint than something like running or sports. If you're doing an aerobics class, you may feel good during the class, but the next day that arthritic joint might be talking to you.
Yeah,
so
you're going to hear from it.
We have to really focus on recovery and keeping that thing strong. I like resistance training for patients, even if it's 5-pound dumbbell while you walk to the mailbox and back. Something simple.
Simple.
That's really helpful.
And here we are at Arkansas Surgical Hospital, but we're not always going to jump to surgery.
Right.
In fact, that's kind of a last resort.
It is. We don't want to do that first. Sometimes we don't have a lot of relief with these conservative options, especially when it comes to severe pain. And so that's a case-by-case situation, and we're trying to avoid surgery. Sometimes it is unavoidable. We just have to fix it, and the fix is a replacement oftentimes. When you're talking about bone-on-bone arthritis, we always try conservative treatment first, and if it's working well, then we let it ride and keep doing what we do and try to avoid invasive procedures. But at times even the patients who end up having to have surgeries, the ones who are more active beforehand, and have flexibility and muscle tone, they do so much better afterwards, and we really want good outcomes. And that's what we're after. Try to help patients get back to doing what they do.
So you really talked about keep moving, do that kind of movement. Nutrition is also important, I know.
Yes, yeah, we have to have nutrition not just for a healthy weight management, but to heal after a big surgery, to decrease inflammation. A lot of nutrition is trying to cut out some things that are causing inflammation.
Sure.
And I'm not a cardiologist, but your cardiologist would agree.
They'll tell you
that
the same thing.
A lot of the foods we're eating are causing problems, and so if we can start
Ooh.
trimming some of those things, that'll help. Plus, I have patients that I put on supplements, a month before surgery and then the first 3 months after, just to try to help them recover and have the nutrients to build new muscle and new tissue.
Really all about that whole body wellness and being healthy. Dr. Moore, thank you so much for being here today. We really appreciate it.
Yes, thanks for coming.
Absolutely. And for more information, go to ARC Surgical Hospital, ARKsurgicalhospital.com.